Well, the Department of Health and Welfare is putting an end to their family personal care services. That would be January 31st when that ends. In an email to personal assistance agencies, the agency wrote, quote, due to concerning trends of fraud and abuse, significant program growth beyond budget projections, and insufficient staff for oversight, they are terminating the family personal care services, end quote. This decision means spouses, parents, or even children will no longer be able to get paid to provide care for a family member who can no longer care for themselves. Hunter Funk spoke to one family in a remote part of the state who says this program was their saving grace.
We live up in Indian Valley, outside of town, in a rural area.
Indian Valley.
It's beautiful.
An unincorporated town with a little under 700 people. For Ron and Tara LaHaye, this is home, and ranching is their way of life. But that changed in 2021.
My wife, Tara, had a massive stroke.
Now, Tara needs in-home care, and finding it in a rural community isn't easy.
I find myself in a position with no help. Tara can't be left alone. She can't get up. She can't move from chair to chair. She gets dizzy. She's the fall risk, and she still has seizures from time to time.
Ron says they've hired several caretakers, only to have them quit a few months later because of the distance. And without a caretaker coming to the house, Ron can't work because he has to take care of Tara. But when the Idaho Department of Health and Welfare began paying spouses as caregivers, it was the answer they needed. And really, their only sustainable option.
I have no other help out here. So it makes sense that a husband and wife should be able to do this job for each other. It makes sense.
The pay helps.
It doesn't pay a lot. It pays some bills. So it's not like we're getting rich off the system. We're barely making it.
Ron says now that the program is ending January 31st, he doesn't know how they'll financially survive.
The workers out here in rural areas are very few. It's hard to find people. I don't know what's going to happen. People are going to be hurting.
And Idaho Health and Welfare says the program has increased by 75% in enrollment since 2023. And without the lack of funds and staff to oversee the fraudulent situations, it's coming to an end. Now, some families are meeting with legislators tomorrow. They're trying to advocate, talk to them, let them know what's going on. So hopefully we can see that coming. And coming up at 10 o'clock, we actually sit down with Health and Welfare. Abby Davis has a story about what they're doing next and just kind of where we go from here.
And that's my next question. Is this an agency issue or is this a legislative issue? I guess it could be both.
I feel like it sounds like both. I think both need to be aware because they get their money from legislators.
Yeah.
The other interesting thing that Ron had mentioned too is, he's paid for by an agency, right, to take care of his wife. So technically, he could go take care of other people if he wanted to.
He has the training, right.
Right,
yeah.
But because she's his spouse, now he's not allowed to.
He can't even take care of his wife.
Right.
Oh, wow,
Yeah.
okay.
Yeah.
All right, we'll pay attention to that. Thank you very much, Hunter.